Preparedness, Response, and Recovery. My name is Dustin Snowadsky, and we would first like to announce that we are recording this webinar. It is also being live streamed on WID's Facebook page, which is facebook.com/World Institute on Disability, and I will also put the link in Zoom chat. For starters, everyone has been muted. You can activate captions on your toolbar located at the bottom of the Zoom window, or you can use a URL to view the captions on a web page separately, which I will post in chat right now as well. You may also pin the interpreter's video feed so that it remains visible during the webinar. You may do this by right-clicking on the interpreter's video and selecting Pin Video. I believe that's all the housekeeping, so let's get started. First, we'll turn it over to Janie, who will kick us off.
Jenny Lear-Stein is up next. This is Marcy Roth speaking. And Jenny, you are on mute.
Okay, I'm unmuted. Hello, everyone. This is Jenny Lear-Stein. My apologies. Can you hear me now?
Yes, we can.
Can you hear me now?
Jenny.
Thank you so much. I want to thank the World Institute on Disability, Marcy, and all of you for joining us today. I am joining you in a most unusual circumstance that maybe really indicates how urgent the issue that we are gathered to discuss really is. My husband and I are sitting in our car on the highway evacuating from Napa and a forest fire on our way back to San Francisco. We have been sheltering in place in the wine country because it is a more remote and much safer community to live in during the pandemic crisis, particularly so since both my husband and I have complex disabilities that make us highly susceptible to a severe impact from the pandemic. Yesterday morning, we experienced what I can only describe as a freaking awesome thunderstorm, and my husband literally watched as a lightning bolt struck and ignited a forest fire in the ridge above our home. We lost power for a considerable amount of the day, and we were on notice to evacuate, and having learned Evacuation 101 from my dear friend and colleague, Marcy Roth, we thought we had everything under control. But if there is one lesson that's been made clear, it's that in these circumstances, there's always more to learn. And in our case, it involved learning the hard lesson of how to make an electric gate unlock with the power off. Needless to say, we were successful. The wind turned in another direction, our power was restored, and we slept soundly last night, only to awaken this morning to see not one but two fires on the ridge, and in the last 3 hours, their exponential growth forcing us to flee. So here's the thing, we are safe, we will be safe, we are the most fortunate in that we have a place to go. But as we heard on the convention last night, our president has undertaken a policy where he is willingly now placing the lives of my neighbors and their children, the grocers and the shopkeepers who have supported us so patiently and without complaint throughout this pandemic, their very lives are at stake. So while I'm grateful that we are able to get away from this fire, I don't think there has ever been a better reminder to me about the bitter reality that we are suffering at the hands of Donald Trump and what we must do to get him out of office and elect Joe Biden and Kamala Harris, who will pay attention to the very real needs of our community and all Americans as they face not only the pandemic, but these concurrent emergencies. That said, I have to tell you the one thing I truly did not expect was the very heavy burden of worry that comes along with being subjected to this experience. I know we're safe. I'm hopeful that our home and our neighbors and our children and all of the people that we interact with in the community in Napa will be safe. But I simply cannot explain to you how emotional this experience has been in terms of the worry that we must carry for people in these communities that are being impacted and that Trump has turned his back on. So with that said, I have also a much happier task that I have been trusted with tonight, and that is to introduce my dear friend and colleague and the leader of the national disability community, Tony Quello. I'm sure most of you know and have worked with Tony as I have for many years because he is an icon in our community. He started, as he told us earlier today at the DNC Disability Council meeting, that he hails from California. And in fact, he served as congressman from California for many years. And during that time, he also served as the Democratic House of Representatives whip and also the chairman of the DCCC. What we always speak first about when we talk about Tony Quello is that he is the originating author and the major sponsor for the Americans with Disabilities Act that celebrated its 30th anniversary just a few weeks ago. Without Tony and the work that he did to ensure that the ADA was passed, none of us would be in the positions that we are today. And the rising generations of leaders with disabilities would be fighting just as hard as he and all those along with him had to fight 30 years ago to make sure that we are included and have equal opportunities. Now, Tony also told us the story today about how he may be unique in American history as also being able to take his disability advocacy to the Pope and affecting a change that has been felt not only in America, but around the world. As in his usual style, he enabled other people who, as he had wanted to, enter the priesthood and not be discriminated against because of their disabilities, visible or invisible. So I just cannot tell you how wonderful it feels to me and what a privilege it is to be able to introduce you to a man I count as my dear friend, my colleague, my mentor, my advisor, my confessor. Tony, let's hear from you, please.
And this is Marcy. I don't see Tony yet. So that was an absolutely wonderful introduction, Janie. And as soon as he joins us, we're going to add him in. In the meanwhile, we're going to move on with the program. And we are incredibly fortunate to have among our partners in tonight's discussion, Maria Town, who is the president and CEO of the American Association of People with Disabilities and a leader and friend who I think we're all going to appreciate hearing from this evening. Maria?
Thank you, Marcy, for that kind introduction and for rolling with the changes. Janie, we are so glad that you and your husband are safe, and we're thinking of everyone affected by these fires this evening and all of the concurrent disasters that are happening during this pandemic. In addition to acknowledging the multiple disasters that our country is currently experiencing as we speak, I want to acknowledge a couple of other things, a few other logistics. One, thank you to everyone who has joined us tonight, both via Zoom and on Facebook. If you are following along and want to broaden the conversation online, please feel free to tweet or post using the hashtags DemConvention, hashtag CryptTheVote, or hashtag Disability Coalition. But the biggest thing that I want to acknowledge is that in addition to experiencing concurrent disasters, our nation is currently commemorating the 100th anniversary of the 19th Amendment. Now, technically, this amendment was supposed to give all women the right to vote, but in reality, it only extended that right to white women. it would be another 45 years until Black women and other women of color were extended the right to vote through the passage of the Voting Rights Act of 1965. And today, many people of color, people with disabilities are frequently disenfranchised and denied their right to vote either through existing law or other aspects of voter suppression. And actually, when we think about it, the communities who are most likely to have their right to vote denied are also those who are experiencing the brunt of the coronavirus pandemic and of larger climate change trends. The COVID pandemic shined a light on the inequities faced by people with disabilities, particularly disabled people of color, inequities that we already knew were happening, but have never been exposed in such a drastic way. We have seen this virus impact every aspect of American life, from the way that we move, the way that we work, the way that we eat, and the way that we vote. Right now, as we speak, states are restricting access to vote by mail, which is yet another way we are all becoming disenfranchised. And though we talk about the coronavirus pandemic as unprecedented times and an event unto itself, this disaster and pandemic is a part of larger trends that the disability community has already experienced far too often as it relates to federal disaster response and being left out and left behind. Today, we are going to hear from 3 incredible panelists about how the federal government's response to COVID is affecting people with disabilities, how we can improve and make our response more inclusive, and how current disasters connect to climate change and a larger climate crisis emergency. So with that, I will introduce our 3 panelists. We have Marcy Roth, the CEO and Executive Director of the World Institute on Disability, Herman Parodi and Shaylin Suzalis, the co-directors for the Partnership for Inclusive Disaster Strategies, and Tyree Brown, an artist and disability rights advocate. So with that, I'll remind people, if you're engaging online, use the hashtags DEM Convention, Disability Coalition, and Crypt the Vote. And let's kick this off. Marcy, let's start with you. Marcy, can you tell us about the current trends we're seeing and how the federal response to coronavirus is impacting people with disabilities? Do these trends reflect what we've seen in past federal disaster responses?
Thank you very much, Maria. Thank you, Janie. We are all hoping that you and Lenny are getting to safety, and we share in your appreciation and concerns for the people of your community. Very briefly, I am an older white woman. I'm wearing red glasses, a blue and black top and sweater, gold earrings. My hair is pulled back. It's way more gray than it was when I first started quarantining. And I also need a haircut. I make those descriptions to provide access, and I'm really pleased to see how many people have joined us this evening. I want to begin by saying that many people have said about COVID, boy, we just didn't see this pandemic coming. Well, I spent almost 8 years at FEMA, and actually we did see it coming. We held lots of exercises. We planned for a variety of scenarios. My job was to engage disability community leaders and other members of every community to work side by side in planning and exercising. One time our scenario was a pandemic and a Category 5 hurricane. Originally, the assumption was that everyone who required power for respiratory equipment, nebulizers, CPAP, BiPAP, ventilators, would be sent to hospitals and congregate care facilities. didn't take long for me to convince people that sending people with disabilities to congregate care facilities in a pandemic and during a Category 5 hurricane was probably not a really great idea for anybody. But so, yeah, this should not have come as a surprise to the federal government. And unfortunately, we are now 171 days in, and 171,000 people have died. That's 1,000 people a day for 171 days in a row. And of this number, we are told that approximately 43% of the people who've died are people in nursing homes. The numbers are even higher when you add other congregate facilities, when you add the kinds of close quarters that many people in long-term care facilities are forced to live in, psychiatric facilities, carceral facilities, detention, group homes, many, many kinds of group facilities that are primarily places where people with disabilities live. So when we hear people talking about, people who are old and people who have underlying conditions are the people who are dying in those facilities, let me be very clear. You don't go to a nursing home because you're old. You go to a nursing home because you have a disability and your community has failed to plan for and meet your needs in the community. 43% of the people who've died of the 171,000 people who've died since March, 43%, that's 73,679 people with disabilities. Every single one of them had civil rights. We worked hard for people to have those rights, to live in the community, to be in the most integrated setting. The decision about whether or not people could live in the community or be forced into institutions went as far as the Supreme Court. And in fact, 21 years ago, it was determined that people had the right to live in the most integrated setting appropriate to their needs. And that's the community. The Department of Justice has told us so, and all of the other federal agencies have agreed. And they've gone so far as to say that the civil rights of people with disabilities are not waiverable. They're not suspended in a disaster. So for 73,000 people with disabilities to die, our federal government has failed. They've failed to enforce the law. They've failed to use any sort of urgency in their response. And so what I can tell you about the current trends, very simply to wrap it up, is that our federal government absolutely could see it coming, should have seen it coming, and we have got to do better. We can get this right. 73,000 people, it's too late for them. It's not too late for the rest of the 1.3 million people living in long-term care facilities because they have disabilities and their communities are not meeting their needs. So I will turn it back to you, Maria. Thank you very much.
Marcy, thank you so much for your service and for your commitment and passion. I know that even with the terrifying data that you just presented, we actually that's probably an undercount because we have had a lack of transparency from a number of providers and facilities. We don't have numbers of people with disabilities who've died who are living in the community, particularly those who utilize personal attendant services. And we don't have a lot of disaggregated data that shows us specifically the experiences of disabled people of color, but we do know that nursing homes that primarily serve Black and Brown people are experiencing deaths at higher rates. And so again, even with the trends that you showed, we could be calling for much better data to inform our response. You mentioned advocates who are fighting to make these responses better. And now I want to turn to two of the advocates who have really been leading the way, Herman Parodi and Shaylin Suzalis, again, the co-directors of the Partnership for Inclusive Disaster Strategies. Herman and Shaylin, Marcy pointed out what can happen when the federal government does not fulfill its promise to protect the rights of disabled people. But even when everything goes right and federal agencies do everything according to policy, barriers remain for people with disabilities that produce disparate outcomes, especially during disasters. So Herman and Shaylin, what are some of these persistent barriers and how do we fix them?
This is Herman. Thank you, Maria. I'll start with, there is an institutional bias that the Social Security Act created, where it creates an entitlement for people with disabilities, as Marcy well explained, end up in facilities, so-called nursing care, and I'm a quadriplegic. I can honestly say that my great-grandmother died in my own home in her 90s while getting care from a provider, while getting showered. That's how she wanted to go, at home. There, after the Social Security Act created the entitlement for the nursing institution, that's everything afterwards. That is the solution. We need, this year has clearly shown us in many levels how we need to recreate the systems. In many conversations that are happening in our circles, the systems were not created for us. And it is needed that we are part and that we are included in the creation of the solutions. Things like, to get a little technical, the 1135 waivers that are activated when there's a public health emergency by the Secretary of Health, expedite nursing home placement. It's likely what happened in New York. It's happening all over, where people, either from their homes or a facility or a hospital, are bypassing traditional regulations and are being placed in the worst possible case scenario right now. And this 1135 waiver is highly used during disasters, traditional disasters, for lack of a better word right now. And it's where, if I am in my house and I cannot, and I call for 911, an ambulance perhaps will pick me up from my door and drop me off in a nursing home, where if anyone Googles it again and again, the stories of what happens in facilities during disasters is the worst. Shaylin and I have been first responders. We were deployed to Puerto Rico after Hurricane Maria and to the Bahamas after Hurricane Dorian, doing international work. In Puerto Rico, we personally saw how in facilities with multiple levels, where aid that is provided will be, but the first floors get it, and often we heard that above levels would not see any aid for days on end.
And this is Shaylin to add to Herman's points. During disasters, people with disabilities are 2 to 4 times more likely to die or be injured in a disaster. We've seen this time and time again as we look through past disasters that have happened, and as we see COVID-19 barrel through congregate facilities like nursing facilities, along with many other congregate care facilities. And we see how the disproportionate impact is always on people with disabilities, older adults, and people with access and functional needs, because they are 2 to 4 times more likely to die or be injured in a disaster or an emergency. And that is the reality that we live in. And as Herman mentioned, the systems are not built for us. They are not built in accessible, inclusive manners. And that is where, when we are recreating our systems and starting anew, creating meaningful ways for people with disabilities to be at the tables, to be decision makers, to be leaders in the community, at the state level, at the federal level, and at every level, that people with disabilities are in leadership roles in meaningful, impactful ways that are decision makers, so that we can be more inclusive as a nation and moving forward together. That is the only way.
Thank you both so much for that response. And now I want to turn it over to Tyree Brown, who is a disability advocate and artist. Tyree, after you acquired your disability, you lived in a nursing home. And now, thanks to the Money Follows the Person program, you live in the community. And we are so grateful for that. I'll note the Money Follows the Person program needs to be permanently authorized so we can make sure more folks can have a similar experience to Tyree. But I'm really interested in hearing about how COVID has impacted your day-to-day life as somebody living in the community. And how do you think your experience would be different if you were still living in a nursing home?
Oh, wow. Yeah. First of all, I'm Tyree Brown. I'm an artist, and the title Disability Advocate is a very humble title, because I am not like Shaylin and Herman. They are the pros, but I'm just the newbie, and I just go around and just sharing my story. That's kind of all I feel I can provide, but should I need to do more, I could. I know this is the DNC talk, but I'm actually quite neutral about where I am in terms of where disabilities lie. Wherever I'm needed, I will share my story. It's important to know COVID-19 it hit us. Well, for me, I had no idea it was coming, but for someone in leadership, it should have been known. But if I was in a nursing home today, I really don't know how my life would be. And I really do thank God that I am home, because I have my mom, who's my home health aide. And even having my mom as my home health aide, first of all, that is a good thing as well, because if I had an outside aide, I don't know who they are around when they would come into my house, or, and who knows if they would have shown up and I would have been stuck without an aide. But I thank God how he orchestrated everything he knew what was coming. And my mom, she's working with me, being my aide, so I know that I am safe in my home. The difficulties, of course, is just maybe the superficial things. Can't go to the movies when I want. But, that isn't something burdensome. But I really do think being home is a blessing. Nothing terrible has happened. Just everything is working smoothly because I am out of that nursing home. And even if there was no COVID-19, being in the nursing home would have drove me absolutely crazy. At the time, I was 20 years old. I'm 25 now. Being there with just the level of care that was provided just wasn't enough for me. And it was because the nursing homes were understaffed. And that's my main thing, having these facilities being understaffed. I believe if they had enough staff, and it's not even about the funding because they get money. I don't know what it is that the facility is being funded. Where is this money going to? Who is this money going to? Because it certainly wasn't to building a staff that would be able to help individuals with higher level of needs like myself. I was considered completely dependent, and I would have stayed that way should I have stayed in the nursing home. But since being home, having outpatient therapy, I can be left home on my own all the time because I was able to gain these skills coming out of the nursing home and being in the community. I hope I answered that question.
You answered it beautifully. Thank you for sharing all of that. Your experiences in the nursing home are far too common. And again, as I mentioned, we're so grateful you're out in the community. Also, I just want to say that your story is often the most powerful thing that you have. And you are an incredible advocate in the way that you've shared your story and shown people that it is possible to be out of the institution and living in the community. So thank you so, so much. And please keep sharing your story.
Oh, and this is my art on my shirt.
Yeah, we'll drop a link in the chat so people can see your work. Sure. Marcy, let's go back to you. So as we heard with Jani's experience that she's having right now, we're seeing frequent disasters, derechos, hurricanes, wildfires, and more. How do these frequent disasters connect to larger issues related to climate change?
Thank you very much, Maria. And Tyree, thank you so much for speaking with this group and helping us to carry this important message. Your art is incredible. I've visited your website, and I'm really excited that we're going to pass your web address on to folks because you are incredibly talented. So I want to just say that whether you connect COVID to climate change, whether you see the hot weather or the unbelievably cold weather or the wet weather or the hurricanes or, however you see any of these particular disasters, we know for sure that their frequency, their duration, and their impact has all very significantly increased. And over the past several years, we've had some of the most extreme weather. The impact of these huge fluctuations in weather are certainly climate related. And for the purposes of this discussion, the issues are whether we're all going to work together to plan for extreme weather, to plan for the spread of unbelievably dangerous flu viruses. Whether we're going to focus narrowly on what's happening in our own community or across the US or globally, the 15% of the global population, people with disabilities, 26% of the US population, people with disabilities, as long as we keep planning as though people with disabilities need to be planned for, as long as we see people with disabilities as being vulnerable, as long as we fail to provide the kinds of accommodations that make it possible for everybody to plan for their own health and safety and independence, or whether we recognize that we're all in this together and we must force multiply. Everybody needs to be a part of community resilience. Communities that are focusing on disaster resilience, but they're not focusing on universal design. They're not focusing on accessibility and accommodations and modifications for the whole community. They're falsely planning for a lack of resilience. If we don't engage the whole community, and if we don't invest in making communities accessible to all and making the community planning a responsibility and an opportunity for the whole community, climate change will have such a detrimental impact. So whether you're doing it because you have a legal obligation, which if you're using any federal dollars, if you fall into many different categories at the state and local government level, you do have a legal obligation. If you're doing this because, you think it's a nice thing to do, or you think it's, charitable, whatever, think about this in terms of optimizing the ability of your whole community to withstand extreme shocks. And if we work together, and if our government works with us, we can, in fact, plan for a much more resilient community before, during, and after whatever the public health or disaster might happen to be.
That's great framing. I love that. Tools to make sure your whole community can respond to and absorb drastic shocks. Thank you. Herman and Shaylin, what does climate change mean for people with disabilities, and how should this inform how our federal government responds to disasters? Marcy already spoke to this a little bit, but I'm really interested in hearing from y'all as well.
Thank you, Maria. Marcy began explaining this. I also serve as the United Nations Disaster Risk Reduction Office focal point for persons with disabilities. And it's about passing information from the ground up and top down, if you will. But our main global resilience framework called the Sendai framework has 4 priorities, and they are understanding disasters, increasing the governance for disaster risk reduction, funding disaster risk reduction, and the last one is making sure there's early warning systems and including people with disabilities, women and youth who are most affected by disasters. Someone on the chat moments ago asked for about the disproportionate impact of people with disabilities during disasters, and we shared a United Nations finding where 2 to 4 people with disabilities are 2 to 4 times more likely to die or be injured in disaster. This understanding came after the Fukushima earthquake in Japan at the beginning of the decade. Now, after being deployed to the Bahamas, seeing and following with our assistance throughout the United States, traditionally, people with disabilities, the systems were not created for us. They don't include us. And now disasters, we can see that they are increasing in frequency and intensity. COVID, a disaster upon itself, it's ravaging people with disabilities and older adults with disabilities. Without an understanding and a realization of this, there's a population that may not make the next decade, and that's people with disabilities. If you look at the statistics, right, we all know that the aging population is outgrowing the young population, and thus the needs are rising. If we do not begin addressing this now, we know this now, we need to begin addressing it now. That is the point.
And this is Shaylin, just to quickly add, as I know we're getting close to time here, and we want to make sure we can get to questions and answers as well. But just to add that climate change, whether you call it that or whether you see that a lot of disasters are happening, it's undeniable, right? We all see it. There's been earthquakes, there's been tornadoes, there's been a fire tornado just most recently. We've had hurricanes, we have hurricanes on the way and much more. And so just realizing that these disproportionate impacts are on the most marginalized communities. And when disasters happen, those are the people that are left behind, that are forgotten, and have the least access to resources and the supports that they need to make it through to the next day. And we need to come together to really focus on the most marginalized so that the systems can then build upon the most marginalized so that it's built for everyone and for all of us. Back to you, Maria.
Thank you both. I'm noting how your comments tie in with one of the things that Tyree said. The nursing homes are getting so much money, but where is it really going? And what would the world look like if some of that funding was given to disability-centered community organizations, right? So on that note, I'm going to go to Tyree. Tyree, how are you thinking about climate change in your day-to-day life? And as we adjust to climate change and address all of these barriers, what do you want your life to look like in the next 10 years? What is the resilient future that you imagine?
Yeah, I was taking notes and really interesting hearing everyone's response. And especially my whole thing is pollution in general. I have I wouldn't say a hard time, but in a sense, especially with individuals who use incontinent supplies, so whereas waste is more than say an able-bodied person. And because I've considered myself, environment conscious person, if that's a term that makes sense. And I find myself struggling with the idea, knowing I'm me and there are lots of individuals with disabilities using incontinence supplies, creating waste, but not intentionally. And maybe even just the healthcare in general, it's a lot of waste that goes on with pollution, and understanding how much materials we use, and we can't help it. And this is what's going on. And for me, this is that push to know, okay, what can I do I'm just thinking of just maybe like environmentally friendly incontinence supplies. Like, could someone, or maybe, I don't know, just scientists do something to help have these supplies that are better for the environment? And it's so much plastic going on, and even just our transportation system, I know we can do better. And just having government programs that help with the environment. I know with my stance politically, I'm like, there has to be more that this administration is doing. And it's just, I see just a better system, especially with solar panels and wind turbines. It's like more energy efficient things that need to happen that I'm doing lots of research on. So I see in the future individuals who need those incontinence supplies having something that's better for the environment, and not just I've seen like there are companies like McKesson. They supply these incontinence supplies, but that company themselves is not, I'll say, doing the right thing for people. I wouldn't get into that, but that's my little bit of knowledge. I don't have a lot, but I have a little bit.
That's a lot of knowledge. Like now I'm like, how can we do it? How can we create environmentally friendly incontinence supplies? Disabled people should not be shamed as irresponsible with the planet. Just because we have to use supplies, like because we're trying to use supplies, we need to survive. That was such a beautiful answer. And it was one that was right on time, because we can now go to Q&A. We have about 15 minutes for Q&A from the audience, and we've gotten a lot of great questions that have come in over the course of this panel. I am reading through them right now, and we've gotten a few questions about something called the READY Act. And I know that this is something all of you can speak to. So panelists, can you tell us what the READY Act is, and can you talk about how we can advocate for the READY Act in the context of climate change?
This is Shaylin, and I will start by infamously, as I am known to, saying what READY stands for. READY is REAADI, and that stands for the Real Emergency Access for Aging and Disability Inclusion, READY, for Disasters Act. This is a key piece of legislation that was introduced last year. And really prioritizes putting people with disabilities at the table, making a body, a national commission that people with disabilities create and provide recommendations and actions for more inclusion throughout the nation and throughout the states. It also really prioritizes monitoring and enforcing the civil rights of people with disabilities, which is one of our key factors in disaster relief, is maintaining our civil rights before, during, and after disasters. As Herman pointed out, they get waived, and we need to stop that. The Ready for Disasters Act goes back and also funds the DOJ to monitor and enforce, going back to past disasters, all the way back to Katrina. So really, we know that work doesn't get done unless it's funded, and the READY Act provides some of those resources for the federal government to do their job and to monitor and enforce our civil rights.
This is Herman. There's two other key provisions very important. Many that are involved in the disaster relief world, response world, are familiar with the Stafford Act. So one of the primary funders of disaster program response and recovery. And however, people with the most disability-led organizations are excluded from accessing those funds. Many times while we were in Puerto Rico, we helped and saw the Center for Independent Living. Centers for Independent Living are disability-led organizations with a board and a staff of over 50% that focus. They are non-residential, advocacy focused, which provide peer support and mentoring, skills training, information and referral, and most key of all, advocacy. We, again and again, we have worked with Centers for Independent Living doing response work during disasters, but they do not get any type of funding. They are helping people with disabilities in shelters. They're helping even the government making sure that shelters are accessible. In Puerto Rico, at the beginning of the year, when the earthquake happened, the Center for Independent Living was able to do a lot of work with the cities to help evacuate the people in registries, because during Maria time, the registries that had it in place, none were used. So there's a problem with registries. We can talk about that another time.
I'm only smiling because I've had this experience in other.
So Ready would open up the Stafford app to have disability-led organizations that are doing the work that should be funded, that should not be charitable, to do the good work that's needed and could do more. Lastly, there's one more. I'm missing it.
Maybe Marcy wants to fill in anything we might have missed.
This is Marcy, and there needs to be a training, technical assistance, and research capacity across the country. Ready is not legislation to make new law. Ready is about making the laws we have, the laws that are supposed to be protecting the 73,000 people who already died in nursing homes, the countless other people who are dying in our communities and in facilities in disasters. There has to be the development of training, the delivery of technical assistance, and the kind of research that identifies what those good and promising practices are that are working in some communities, so that we can transfer that knowledge to other communities. I want to point out, I see two really important things in the chat that I just want to sort of reflect on for a moment. And one of those, I want to be really clear that when we're talking about people with disabilities, we're talking about all people with disabilities. We're talking about people with intellectual disabilities. We're talking about people who have mental health disabilities or receive some mental health supports. We're talking about autistic people. We're talking about people with multiple chemical sensitivities. We're wanting to be very intentional about centering all of this around, as Maria was saying earlier, people who are disproportionately impacted, multiply marginalized, people with disabilities, people who are Black and Brown and Indigenous, other people of color who experience poverty and exclusion, and in a disaster, they are doubly, triply impacted. I also want to point out, and Joyce Bender, who always asks very important questions, is wanting to understand what's happening with healthcare disparity in the community. And she asks about Michael Hickson. And I'm wondering, I'm going to pass it back to you all. Maybe we could spend a couple of minutes talking about what happened to Michael and how this should never, ever, ever happen again. So I'll send it back to you, Maria. And
I'm the moderator here, so I'm gonna really center it on the panelists, Herman and Shaylin and Tyree. If y'all could talk about what happened with Michael Hickson and how that connects to larger trends that we're seeing right now, that would be great.
Thank you, Maria. This is Herman. Just confirming which city in Texas. I believe it was in Austin. About a month and a half, 2 months ago, a father, a husband, a community leader, as we've come to learn, Michael Hickson, a Black man with a disability, ended up in a hospital and with complications, and with being in the hospital, he was denied food, hydration, as is read in the understanding, and was left to die. He died slowly. It took him a week to pass away from being abandoned, from being neglected in a hospital. His wife was trying to work the system. There's always a system that is not friendly, that again was not built by us, so it works for us. His wife, sadly, during that week, had to end up seeing him die, as well as his children. Michael Hickson is not the only Black person being denied basic healthcare access. We at the partnership have a disability hotline, disability and disaster hotlines. And at the beginning of the pandemic, we responded to numerous calls of Black people being denied basic healthcare access in hospitals just because of their skin color. I have been with an activist with ADAPT. I've been arrested numerous times fighting for disability rights over 15 years myself. And in that time, I have talked to many Black activists who have shared with me that the difference of how police respond to a white versus a Black activist. And when there are injuries, how in hospitals, when there's activists, hundreds nearby that sometimes have to be going to the same hospital again and again, Black activists, this is standard, this is ongoing. And we know this, we've known this. George Floyd and his murder began this conversation very strongly in our country and within the disability community. And I have done so much work with BLM over the years. But in the disability community, now at the beginning of COVID, we were, where is our 50,000 names so we could call them out? We have a name, Michael Hickson. Let's not repeat it.
Thank you, Herman. Tyree, I want to make sure we hear more from you because you have so much wisdom. Do you want to add anything onto what Herman just communicated?
I'm learning from them too. I appreciate hearing them. I just like listening, and I don't. They said it all.
We have 2 minutes left. I think we have time for one more question. I'm going to ask this question from Catherine Miesman, and it's a little bit of a different tact. Catherine asks, do you think that requiring teaching disability history in K through 12 education and funding it in universities would force the country to confront the systemic dehumanization of disabled people? So I'll open that up to all the panelists.
I just want to say that's a very good question. Never ever thought of that. I know growing up in school, I had no idea what a disability actually meant. I would see those handicap parking signs. I'm like, are those necessary? Because I didn't understand what a disability was or seeing it, because I never saw it firsthand. And even if I did see it, I didn't know how to identify it. I think that is a very good question. I think having that education is needed, and knowing that, because it wasn't until my injury in 2015 I became quadriplegic that I even knew what a quadriplegic was or what a spinal cord injury was. It wasn't until I knew that individuals suffer from autism, or maybe not suffering, but they have it. I didn't know all of these terms, and should I have known, or other people would know, there'll be less violence against individuals, disability, bullying, all of this. It's needed.
And this is Marcy, and I think, education, they often say, everything I learned in kindergarten. I think the fact of the matter is we need to be doing a much better job of educating every step along the way. And, when it comes to the decision makers in this country, the bottom line is that we have got to make sure they may not have gotten the education that they should have gotten, but they have an obligation. Every federal dollar must be spent in compliance with civil rights law. They need to be held accountable, and people with disabilities need to be serving in senior leadership roles across the federal government to bring the expertise that we have been focusing on developing for many, many years. We need our young leaders to be assuming leadership roles and carrying us forward into the future. And that's got to start at the local community, and it's got to start at the federal level where the money and the decisions are.
All right, well, we are a little bit past 8. I know we had many more thoughtful questions, but this has been a fantastic panel. Thank you to all of our panelists and speakers. Thank you to everyone who joined. This is not an endorsement, but I hope you all enjoy the rest of the convention today and over the rest of the week. We have made a similar offer to the RNC for a similar panel. Hopefully they will take us up on it. And if you happen to attend the RNC as well, you can see us again there if we're able to confirm. Thank you all very much for this great conversation.
Thank you, everybody.